Good evening. Welcome to Spec Yourself's Thursday night webinar program. Tonight we bring you the Thyroid-Autism Connection presented by Dr. Ron Grabowski. Slides and other available materials are located in the resource box on the left of your screen. At this time, I would like to welcome Dr. Grabowski.
Thank you, Jessica. Good evening, everybody. Today, we are going to talk about the thyroid as well as autism connection. And even though, of course, they're two separate conditions, you'll see by the end of this evening on how closely they are related to one another and how certain nutrients and other connections in regards to physiology and biochemistry, these two really play a role with one another. And so as a child is autistic and as they advance later into life, then once again you will see how thyroid dysfunction may come into play at an earlier stage than you really realize. The first few slides, of course, we're going to go through a little bit of the definition or recognition of autism as well as some of the statistics, and so I may go through these a little more rapidly, but once again, as Jessica mentioned, that these are available at any time to get these slides. So, of course, a lot of people talk today about autistic spectrum disorder or also pervasive development disorder, and we know that this condition actually occurs at a very early age. And once again, we'll show you at certain times of childhood when certain things may occur and why certain deficiencies can make a huge impact on these individuals. And also how a mother during pregnancy, her more or less nutritional status actually sets this whole stage up with not just autism but thyroid as well. So, of course, some of the major signs and symptoms that we see with these kids is communication is not really evident with these. As you know, they're very evasive. If you try to communicate with a kid or if you walk in a room with a child that has autism, they'll often run behind their parents, or they'll become very cuddled with their parents and don't really want to talk with a clinician. Of course, there's a lot of repetitive behavior that we see as well. And as you hear from the parents, that it's not just with adults but also with other children, that the social interaction is not very good. As you can see from this particular slide, that autism is really increasing over the past decade and continues to be a problem. And you'll see later in these slides on all the things that we have to consider when we are dealing with these children during developmental times as well as growth and development as they get older. And when I say developmental times, I'm talking about, once again, pregnancy, when the mother is, of course, bearing these children and therefore forward. We also know that there's some increased incidence based on the race and ethnicity of these individuals. As you can see, the white non-Hispanic and black non-Hispanic have a little higher tendency for this particular condition. Once again, it may be due to certain dietary lifestyles. It may be due to locations. Once again, I'll explain that in a little more detail and what I mean by that. And, of course, we do know that there's some genetics as well involved with this particular group of individuals. As far as nutritional risk factors come into play, as I mentioned, genetics are involved. Of course, nutritional deficiencies, which we'll talk about, imbalances, which definitely is a role that you have to be watching with certain nutrients. But whether or not there's been some infectious disease process going on, whether there's environmental factors, are there toxins, are there pesticides and herbicides and things like that that may have been involved in dietary intake. And we know that there's, once again, a lot of controversy with that right now with these fertilizers and so on. But you can see here with the second bullet that with genetics that there's about 70% cases underlie some genetic relationship. Now, is it a nutritional deficiency that sets off or turns on a particular genetic portion, or is it a deficiency initially that actually started this whole thing? And then we're going to talk about the relationship of autoimmunity and autism. And we'll also talk about autoimmunity with thyroid dysfunction as well. And this is one of the things that connects these two conditions is the overall immune system. Is it being modulated properly, and what really modulates the immune system that is common to both of these conditions? Based on a lot of the research out there, these are some of the major nutrients that you should be looking at or considering with these particular individuals, especially vitamin D. You know, a lot of people are talking about that 65 to 80% of the population may be deficient in vitamin D. Of course, vitamin B12 in the methylation issue. We'll talk about that a little further down the talk today. And also, you know, what other nutrients are associated with that? Are there medications that maybe the mother is taking that is setting her up for B12 deficiency, eventually going and causing this deficiency in fetal development as well as once the child is born? Of course, calcium comes into play, and we'll talk about how that is affected by certain nutrient and dietary changes. Zinc is a major player, but we're going to talk about some connections with zinc and another nutrient that you always have to consider. And then vitamin K. We'll get into why we look at vitamin K and why vitamin K may be involved in this condition, and also with the thyroid, and of course vitamin A. Now when we talk about vitamin A, of course a lot of people are very hesitant about dealing with vitamin A with children and even adults because of the so-called fat-soluble toxicity concern. But I think you'll see some interesting information regarding the importance of vitamin A and vitamin D together with this group, as well as with thyroid. A lot of talk has been out there for years with the MTHFR and the involvement with various conditions, whether it's infertility, whether it's miscarriages, once again, diabetes and high blood pressure and various other concerns. And of course, this is another area that we're looking at. And we all know that folic acid fortification has been around for a long time, and a lot of people out there have these mutations with the MTHFR, and we have to consider that. So if you're dealing with a person that is autistic or in that whole spectrum disorder group, that this is one testing that you definitely want to perform. And we'll talk more about this, why it's so important, and nutrients that are associated with this, besides just what we call the big three, the B6, the B12, and folate, that we know that there's other nutrients involved in this pathway. So when we look at folic acid / folate, what is the role, or what are the concerns, or what are the main bases that this particular nutrient, whether it's a folic acid form or the folate form, that actually is so critical to our growth and development? As you can see here, we can't replicate cells without, of course, this particular nutrient, and we know in the developmental years that the first 12 weeks of pregnancy are crucial for neurological development. And once again, a lot of times women won't know that they're pregnant until about the 5th or 6th week of pregnancy. So hopefully they've already started taking a prenatal. It's a kind of a pre-planned pregnancy. But for those that aren't, once again, this is a concern. We know that, of course, the DNA and RNA replication and that role, and the protein methylation as well. So all of this is very important when we are looking at this particular nutrient, and how this nutrient we'll find also affects other nutrients. We are now looking at receptors regarding folate, and is this involved, and how is this playing a role with these particular individuals? So these individuals may be taking enough per se of a folate supplement, or maybe even enough folate in food, but they may have some receptor abnormalities, or some type of autoimmunity involvement may be affecting these receptors. So once again, it's kind of like when we look at vitamin D today, we know that people may be taking a lot of vitamin D, but yet they might have a vitamin D receptor SNP or something like that that's inhibiting them from fully using that vitamin D. And for example, we see that with MS patients, that they have, some of those individuals have vitamin D receptor abnormalities, so these individuals may be taking 10 or 15 or 20,000 IUs of vitamin D a day to more or less get adequate function of that particular nutrient because of their receptor mutation. Well, the same thing is true with this particular group. So when you're supplementing these individuals or evaluating their diets, are you realizing that this is a possibility? So you might have to go higher than what you expect, but at the same time, we also have to be careful about over-methylating these people as well. We know that there's a connection with homocysteine, of course, and folate and B12 and other nutrients in the methylation pathway. And we know that, of course, this is an area that we talk about with strokes, we talk about cardiovascular. We know that homocysteine also plays a role with skeletal formation or maintenance, and it goes on and on and on. Well, you'll see later down the lecture how cardiovascular disease has been associated with this condition, and we have to be concerned with not just cholesterol, triglycerides, and those particular parameters, but also homocysteine and some others that we'll talk about later this evening. Vitamin D status in autism is starting to become very numerous in the literature. You'll see some things that come out as far as the mechanisms or proposed mechanisms with this particular one. And you can see here on the second bullet where we know that there's certain times of the season that are involved. Now, it's kind of a misprint in this. Whoever, once again, cited this information in the literature where they talk about it, birthmarks in various countries, and of course Boston is mentioned there as a country, and we all know that that's, once again, a city, but Denmark and Sweden, of course. So these particular countries and that time of the year definitely seem to have an increased incidence of, once again, autistic individuals. And so we know this through even like other immune times of the year that we know the flu season is, of course, through usually, like in the United States, from October to March. Of course, those are the times of this year that, once again, we see the lowest levels of vitamin D. We also know that depression is higher during that time of the year. So we definitely know that vitamin D plays a major role with the central nervous system, and once again, you'll see in other areas as well. So this is a little bit of information about vitamin D and autism hypothesis, and how one of the main things that we see is the upregulating of the DNA repair gene. That vitamin D may actually play a role in the repairing of DNA. So if we have DNA damage as the baby's being developed, that once again, that this may be something that is going to help prevent that. Once again, the other thing is are there DNA mutations that occur that also increase the chance of this particular individual developing autism? So once again, instead of just thinking about autistic kids once they're born, are we really putting enough emphasis on the mothers and saying, look, you need to maintain your vitamin D during pregnancy or even prior to pregnancy to help ward off some of these conditions, whether it's autism or diabetes or heart disease or whatever. And once again, I'm going to connect the vitamin D with this condition as well as autoimmunity and thyroid conditions later in this webinar. Other mechanisms that we see, of course, that are correlating with vitamin D, and of course this is where we see this with cancers, we see this with cardiovascular disease, and other particular autoimmune diseases like rheumatoid arthritis, is the anti-inflammatory role of vitamin D, and how this may actually show to be a preventative effect. We're seeing this in chronic pain, where people that have chronic pain are taking higher dosages of vitamin D and seeing benefit, and once again, because of its anti-inflammatory effects. We also know, of course, the regulatory effects of the T cells. We know the overall modulation, and this is something I want to emphasize to all of you, that when you talk to other clinicians or your patients, that you use the word of modulation when we talk about this immunity effect, because that's so important. Because when we think about, okay, a person has an autoimmune disease, we don't want to enhance that because that's actually going to make it worse, but it doesn't do that. It modulates the system. And once again, you can see the upregulating of glutathione, a very powerful antioxidant that we know is very important for the central nervous system protection, and vitamin D may play a role in there as well. And of course, I've cited some pieces of literature where this particular information is extracted from. Atherosclerosis, once again, we have found can be affected by, once again, vitamin D. A lot of people don't talk about vitamin D when they talk about cardiovascular disease. If they do talk about it, they talk about it more from a cardiac ejection fraction or the intensity of the muscle contractility rather than the actual plaquing or atherosclerosis. But you will see this as well in these individuals. We see this also in other autoimmune disease because I think all of you are aware that, the incidence of cardiovascular disease is very high in people with lupus and rheumatoid arthritis, and this could be one of the nutrients that actually plays a role with those. So anytime we have an individual or a condition that may involve vitamin D, we always have to think about cardiovascular insult or relationships. Women that suffer with gestational diabetes, we know that this may set off some issues down the road. And we know that, once again, that diabetes is more common in autistic kids. So the question is, once again, the pregnancy status of that woman has a huge impact, as we all know, to down the road. In fact, I was reading an article not too long ago that they were saying that the first 2 years to 2.5 years of life are crucial for what happens later in life with our immunity, with, of course, our development, and definitely with our microbiome, which I'll talk a little bit about later this evening. So once again, it's very important that we watch these women when they're pregnant, make sure that they don't get into the situation of gestational diabetes. Going back to vitamin D, as you know, is essential for insulin production, insulin secretion, and insulin receptors. So when a woman is pregnant, if she does have a vitamin D deficiency, once again, not only is she putting herself at risk, but potentially going down the road for an autistic child. Once again, one of the inflammatory markers, of course, that we're all familiar with is a C-reactive protein. This is something else that has come about. We've seen other inflammatory markers that you can see in the second bullet there, more or less, or the check mark, talking about interleukin-6, of course, tumor necrosis factors. So all of these come into play with this particular condition. What's interesting is I was given a lecture not too long ago, and we were talking about cardiovascular disease, and I was talking about, the elevation of CRP, and I was going up to the audience and asking the clinicians in the audience, what nutrients or what products do you use to help regulate CRP? And, of course, things came up like turmeric and resveratrol and various other herbal products. And I said, well, what's interesting about that is those definitely can do that. But a vitamin D deficiency can cause an elevated CRP. A magnesium deficiency can cause CRP elevations, and CoQ10 and so on. So if you are giving some of those products like turmeric and resveratrol and omega-3 fish oils, you may lower the CRP, but you may also be masking an underlying deficiency, such as vitamin D. So don't think that if you do a cardiovascular panel and you lower CRP by giving them omega-3s that you really have addressed all of the issues. You have to consider that there may be some other vitamins or minerals or some other constituents that may be actually responsible for knowing that or lowering that, and knowing that is essential. And that's why I tell some of you that I've talked to on a consultation, I've told you that it's very important that you do the micronutrient test with these other tests because you want to see the underlying cause of those particular findings. Dietary restrictions, of course, when people talk about multiple sclerosis, they talk about autism, they talk about ADD or ADHD and various other conditions that they think are autoimmunity, one of the things that jumps out right away is people say, oh, you better be on a gluten-free diet, or you better be on a dairy-free diet, or, people are always throwing out these different dietary restrictions. By doing that, we also have to realize that we're predisposing these individuals to certain nutrient deficiencies, and those nutrient deficiencies are then lining up to cause other problems in the body. And once again, one that I'll talk about a little later but mention real quickly now is selenium. When people go on gluten-free diets, you have a very high chance of pushing someone to a selenium deficiency. Well, what's interesting about selenium is selenium helps make natural killer cells. And as we know, that natural killer cells are very, very important for the immune system. So if we push someone on a gluten-free diet and we get them into selenium deficiency, and now we don't have adequate natural killer cell activity, our immune system is going to be affected. And so this could indirectly cause an autoimmune disease. And you'll see how selenium comes into play with thyroid dysfunction. So once again, when we take these young children and we put them on these restricted diets, there's no way any of us can just predict what these people are going to be deficient. We need some objective data to once again determine what they're low in. B6 is another one that we see when people are put onto a gluten-free diet. What I think is interesting, and this is probably not surprising to any of us, that the GI tract is highly associated with this condition. You know, there's a lot of research out there today on the gut-brain axis. And we know that certain things affect our microbiome, whether certain medications. We know certain deficiencies don't allow our microbiome to proliferate like it should. But you can see here that about 50% of children that have autism have at least one GI symptom. In some cases, the GI symptoms actually overpower or overestimate the actual neurological involvement. So what's important when you are evaluating this group of individuals, not just the individual themselves, but the parents of these individuals, is getting a good history of the GI function of this individual. Are they constipated? Are they diarrhea? Do they have irritable bowel syndrome? Do they have a lot of flatulence? What are their, things that are occurring? But it seems like most parents are saying, well, they're non-social, they don't communicate well, and various other things. And so they're looking at those particular signs and symptoms, but they don't realize, because of their lack of education, that the GI tract has a significant impact in this condition. And once again, as I mentioned, we will see that with thyroid as well. Intestinal permeability, of course, comes up with a lot of autoimmune diseases. We know that rheumatoid arthritis, we know that MS, we know that lupus, and various other autoimmune diseases. People talk about intestinal permeability or leaky gut syndrome, whatever the situation case. And here's some research showing you that was noted in the Journal of Pediatric Gastroenterology and Nutrition in 2010, talking about confirming intestinal permeability through the lactulose/mannitol test. We also know that zonulin is also a very important product, and once again, this helps confirm intestinal permeability, and some of the antibodies actually attack these particular products, and some of the companies out there actually can monitor these particular components to confirm that if you are trying to perform support for the GI tract, are you really affecting the intestinal permeability or the leaky gut? The microbiome, of course, is very, very interesting in regards to this particular condition. You can see here there is a study published in PLOS One in 2013 that talked about how less carbohydrate degrading and fermenting bacteria were noted to be a little bit different than some of these other microbiome. And then, of course, in another study, they reported Clostridium species and Enterococci were also isolated more frequently in the samples of these particular children. So, as we see here, that once again, the microbiome is very important. As I mentioned earlier, we know that a woman's microbiome when she's pregnant has a significant impact on these particular types of cases. Ratios, they're now looking at some ratios of various bacteria in the microbiome, and you can see here the firmicutes and the Bacteroidetes ratio has also been looked at, and this was recently published in Microbiome in 2017. And of course, also SIBO has come about and been associated with these particular individuals. So whether it's the small intestine or large intestine, or things that we maybe do even to the stomach, whether it's like proton pump inhibitors that maybe the mother is taking during pregnancy because she has reflux during the latter part of her pregnancy, or we're giving these young children at birth, or for maybe at 6 months or a year, we're giving them PPIs and we're affecting their microbiome. How that may eventually present with some of these individuals, when they're 2, 3, 4 years of age or older. One of the minerals that seems to be coming up quite often now in the literature with this particular condition is zinc. And as you know, zinc has over 300 functions in the body, just like magnesium. So zinc and magnesium together have over 600 possible biochemical functions. And when we take this particular nutrient at a very low level, it of course predisposes us to conditions like this. Now what's important about this, and a real important point that I want you to remember, is folate and folic acid actually can inhibit the utilization of zinc. Now I know there's controversy in the literature, but I can tell you in my office and talking to several clinicians around the country that they see the same thing I do, that when women or men take high dosages of folic acid or folates, that it can cause a decrease in zinc. What's very interesting about zinc, if you go back to the history of zinc and in OBGYN literature, that zinc deficiency has been associated with neurotube defects. We primarily think about neurotube defects in folate, but once again, we now know that this is also very important. And you can see here that about 50% of these autistic kids reported a zinc deficiency from 0 to 3 years of age. Now, the interesting thing about this is the studies that show this, they were using serum zinc levels. And we know that serum zinc is not a very sensitive marker. So if we're seeing about 50% in these individuals, you can imagine if we start looking at more sensitive testing like intracellular zinc levels. These are some of the major important things with zinc. One, we know that the development of the nervous system is dependent upon zinc. The neural migration is important, of course. We look at cognition, of course, also being connected to this as well. And the thing is, if, as you know, zinc is, the bioavailability of zinc is highest from animal products. And one of the things I always have to discuss with the vegetarians in my office is they'll say, yeah, but I get my zinc from nuts and seeds or some other products that are plant origin. And I say, what's contained in that product doesn't mean that the bioavailability is good. And they've shown in some studies that zinc bioavailability from plant products may be around 10 to 12%, where zinc bioavailability from animal products may be around 60%. So you can see there's a huge difference between the bioavailability from an animal product to a plant product. So even though as we look at the content of the food and we're trying to educate our patients on eating healthy and consuming foods high in a particular nutrient, we also, as clinicians, have to keep in mind that what is the bioavailability of that nutrient from that particular food. Not the content, but the bioavailability. And I think you will find it if you go into some of the scientific literature, how surprised you will be on the bioavailability of food or nutrients from particular foods. And so even though people eat a so-called healthy diet, they aren't going to accomplish what they want to as far as dosages. One of the things that we always look at we should look at when we look at zinc is we should always look at the ratio with copper. And you can see here that there's some evidence that low levels of zinc often occur along with high levels of copper. Now, once again, it's interesting is copper is related to dopamine, zinc's related to dopamine, and there is some information about dopamine's relationship with autism, along with other conditions. As you know, when people have a high dopamine, they get that reward benefit. If you do something really good, you get excited about that. That's one of the functions of dopamine. and also, of course, focus as well. So we always look at these two nutrients also in another condition, as we know, of ADD or ADHD. But this is something that we should never forget about. We should always remember that zinc to copper is a certain ratio. Some people say 7.5 to 1, some say 10 to 1. When you start to get a 15 to 1 zinc to copper or higher, you have a very high chance of causing a copper deficiency. And once again, if you get too much copper, we know it can affect zinc. Not just that, but a lot of these divalent cations can be affected by each other. So calcium, magnesium can also affect copper and zinc on an individual basis. Now, we talked about intestinal permeability or / leaky gut syndrome. And I know a lot of people talk about prebiotics and probiotics and various other nutrients, but this is one nutrient that is very, very important with the system, is we have to make sure that they have an adequate zinc level. Because if they don't have an adequate zinc level, they cannot perform some of these things that you can see occur with zinc deficiency. The mucosal necrosis occurs, we get ulcerations, and really this can happen from the oral cavity to the rectum. We get, of course, increase in mucosal cell death. We get more inflammation, of course, and we start to, increase our edema in this area. And what's really important is zinc plays a very close role with vitamin A. That if we are low in zinc, we often have the possibility of vitamin A deficiency, and you will see that this comes up later with this condition as well as with the thyroid. Fat-soluble nutrients that have been associated with autism, we already talked about vitamin D, but you can see here vitamin A. They have found that vitamin A deficiency as well as vitamin D deficiency has shown to exacerbate these particular conditions. Now, once again, we have to be careful with vitamin A because we know of its role with the bone integrity, and where if we give too much vitamin A in the form, especially in the form of vitamin A retinol, let's say retinol palmitate versus beta carotene, that we have a better chance of affecting closure of the epiphyseal plates and some skeletal malformations and things like that. So, but you can see that this is very new information. It was published in January 2018, and it's something that we have to keep in mind. What might be part of the role with vitamin A in this particular condition? Well, it has to do with hydroxytryptamine. And as you know, 5-hydroxytryptamine is serotonin. So we know that, once again, that this particular nutrient may help modulate or control this particular product, and it may, once again, have an effect on these individuals. The other thing that we have to keep in mind is vitamin A is essential for epithelial regeneration. I don't care what kind of epithelial cell you're talking about, whether it's columnar or cuboidal or transitional, any of those epithelial cell types are dependent upon vitamin A. So when we're talking about repair of the GI tract, not only did we just discuss zinc, but we also have to consider vitamin A. And once again, like I said, yes, we should be cautious with children, but at the same time, we have to be adequate with children in regards to this. Some of the other things that we have found with these individuals, that these children also have higher body mass indexes. They often have a deficiency of vitamin D, but also B12. Now, is it related to the MTHFR? Some cases it may be, some cases it may not. It may be dietary restrictions that these individuals are put on. If they go, once again, if they become vegan or the mother is vegan, she may, once again, impose these particular deficiencies on these individuals. Well, we know that B12 is associated with homocysteine, and it may be one of the reasons why cardiovascular disease is also associated with this group. And, of course, we talked about vitamin D and the relationship with inflammation with these individuals as well. So we can't just think short-term and just think neurological. We also have to think other systems like cardiovascular disease with these particular individuals, in addition to, of course, the neurological component. Mean platelet volume, a simple finding that we see on a CBC with differential. A complete blood count analysis will help us determine this. We know that this has a role with plaquing. We know, of course, it has a thrombogenic type of implication. So this is something that we look at. As we know, if a cell is immature, it's going to be larger, and it's going to cause some problems, whether it's an immature red blood cell, immature platelet, immature white blood cell. All of those can be very detrimental to us. So this is something we also want to consider. So when you're doing some laboratory diagnostics, you want to look at the MPV on these particular individuals. So how does some of this information now go into or related to the thyroid? How is this autism/thyroid connection come about? I think you'll see this in a few minutes here, the connection of the nutrients that we recently talked about, in addition to, once again, the ones we're going to further discuss. Of course, this is some basic information that you're all aware of about T3 and T4, and we always, of course, look at converting the T4 to T3 and what may help us do that. So when we talk about hypothyroidism, of course, we always think of one, is the thyroid able to make this particular hormone, whether it's T4 and then eventually T3? Does it have the components to do that? Is there an autoimmunity that's attacking the thyroid? And once again, we'll get into that in a little bit. But the point is that there's so many things that actually are associated with this. And some of the morbidities that people see with this condition, we also see with the autistic children or autistic individuals. And that's why there is a connection. And once again, I think you'll see this very closely in a few minutes. Like I said, cardiovascular disease is associated with autistic individuals, and we also know that cardiovascular disease is associated with thyroid. Now, one of the things that happens or seems to be out there a lot is people say, oh, you have thyroid issues, you better take iodine, or we really need to push iodine because people don't get enough iodine in their diet. There's certain areas of the country and other countries, of course, that may be low in iodine. And yes, we know that that is associated with thyroid dysfunction. But one of the things that's really interesting about this is that we know that there's a connection between these three nutrients. There's a connection with iodine, there's a connection with iodine, selenium, and iodine, selenium, and zinc. We already talked about zinc with autism. And I talked earlier about selenium deficiencies in autoimmune diseases by people that take a gluten-free diet. That when you're on a gluten-free diet, you're pushing that individual into a selenium deficiency. So you can see here that a person could have an autoimmune disease, say rheumatoid arthritis. And of course, there is some literature on gluten-free diets maybe helping with rheumatoid arthritis. But by doing that, now you push the person into a selenium deficiency, and that selenium deficiency now causes a thyroid dysfunction. And if the mother has this condition, say she has RA prior to pregnancy, she goes on a gluten-free diet, she becomes selenium deficient, now she's setting up her immune system to set off an autoimmune reaction, and now the child becomes autistic. So I think you can see that there's a connection there, and the same thing with the zinc. So we know that selenium deficiency in laboratory animals, we also have seen this in adults, can cause changes in the thyroid gland. And we also know that these become more severe if there's a zinc deficiency with selenium. So this is why it's so important to get an overview of several nutrients involved. And this is why I think it's so difficult for researchers out there today to really look at nutrition research in a single nutrient. We have to realize that, yes, we have to limit the variables in our research, but at the same time, in nutrition, we also have to realize the various nutrients that are connected to one another and how one can definitely affect another. And so once again, this is a good example of that. Well, the other thing that comes into play, as I mentioned, with the autism is zinc deficiency. We see this with thyroid. What's interesting is zinc actually is required to convert T4 to T3 and also affects your thyroid receptor. So when someone is deficient in zinc, there are a couple major steps or functions that are really affected with the thyroid. It's conversion of one form of the thyroid hormone to another and actually activating the thyroid receptor. So this is something that's very important. And like I said, if people are consuming foods that have high zinc content but low bioavailability, it gets us into a situation that can be very distraught. This is some information I mentioned just a few minutes ago about how zinc is really involved in the nuclear receptor and how this is so important. Every one of my thyroid patients, or nearly every one of them, we look very closely at zinc. And I would say probably at least 80% of my patients that have thyroid dysfunction, when they see me for the first time, they usually have zinc deficiency with SpectraCell testing. And what's interesting about that is SpectraCell doesn't know their condition when I get the result. And so we correlate, once again, zinc and the thyroid receptor as well as conversion. Now, this is a little bit of information about zinc and the absorption and how oxalates and phytates actually lock up zinc. And this is where you get into the various forms of zinc and why you want to use a zinc like a zinc glycinate versus a zinc oxide or a zinc gluconate or something like that. That those are less quality forms. That the zinc glycinate is a much better quality form and something that you want to address. Now, if we're looking at GI tract healing, we look at zinc carnosine. So there's various forms that we use for different reasons. But once again, going into the literature, I think is very important as a clinician that you know that there's different forms that are going to be better for correcting these than others. And once again, one of the major things that happens out there, and we all are aware of this, is companies want profit margin. And the public doesn't know the good quality, and that's why they're coming to individuals like you and me, is they need that advice, and they want to be shown that, once again, there is a difference between one versus the other. And like a simple example I use with my patients is cars. I said, you know, Volkswagen and Mercedes, they're both cars, but there's a reason why you pay more for a Mercedes than you do a Volkswagen. Well, the same thing is true with these particular nutrient forms. So one of the things we have to talk about, of course, and a lot of clinicians, and you may be one of these, that we're talking about detoxification. You know, how do we detox our patients so they don't get some of these problems? Of course, we know that there are a lot of environmental factors that come into play. And these are just some that have been listed in literature, and you can see a very early part of the 1900s, or 1990s, I should say. And so things like this also have to be addressed. You know, is the woman, or was she a smoker? Did she take medications? You know, was she sick? Or did a child get sick early when they were born? All these things come into play, and how can these things want to be combated prior to the birth of the child or once the child is born? So talking a little bit about more selenium, as I mentioned, that selenium helps, once again, with glutathione status. As we know, is very important for neurological. It helps with, of course, conversion of T4 to T3, and so that's essential. And once again, there's quite a bit of literature coming out now on how our soils are really being depleted of this mineral. And so I think it's very important that you keep this in mind, but yet at the same time, you don't go out there and just start throwing selenium at people and say, well, I think you need to take this, without really having some objective data to determine that. So what are some of the properties of selenium or relationships with selenium that actually can help us in this aspect? One, we know it's a very strong antioxidant. Two, we know it has anti-inflammatory effects. You can see the strong relationship is glutathione peroxidase, which, of course, shows with these benefits. And one of the things we have to keep in mind is the lipid layer of our cells are highly affected, you're probably all aware of this, are highly affected by free radicals. So when we start to damage our lipid portion of the cell membrane, that we now are setting up the fact of inflammation. And so this is why our antioxidants are so crucial, and once again, keeping in mind that selenium deficiencies can occur. You can see here, this is a study that was published in 2002 in Journal of Clinical Endocrinology and Metabolism, where they showed, and these individuals in Germany, that when selenium was administered, that once again it showed a significant reduction in some of the antibodies of this particular, of the TPO. And so once again, this is very important to keep in mind that if someone does have elevated TPO antibodies, that we can do something about it. And one of the nutrients that does that is, once again, selenium. Now, what are some sources, once again, of selenium? We talk about meat products. You can see they have about 31%, but a lot of people consume, once again, these grains, whether it's pasta or rice or these cereals, once again. And even though it doesn't look like a high percentage, if you think about kids and maybe your family, how many of you really eat a lot of fish on a weekly basis? So even though we find sources of selenium in these particular products, is also what's the intake percentage of these products. This is why I was talking about when you start cutting out your gluten-containing products, that you really see some changes in these particular levels. Absorption, excretion, you can see here that most of the selenium is absorbed in the small intestine. You can see here on the average about 65%. The excretion, once again, the kidneys, intestinal excretion is involved in only about, once again, 5% is lost through the saliva and or perspiration. So, once again, our kidney function is very important, but if we have an inflammatory response in the intestinal tract, then once again, of course, this level is going to be increased. Here are some selenium intakes, once again, that have been shown around the world. You can see in the United States and Canada, based on 2000, that males consume about 55 micrograms, women and about the same thing. But you can see in places like Australia or Belgium, those are much higher, well, not so much higher, but about a quarter of a higher percentage than, say, the others. But even with that said, if you go into the literature with selenium and thyroid, that they say that you have to be right around 200 micrograms to really have adequate thyroid function. So with these numbers, you can see that they're well below. It's barely over 25% of what we should be consuming. And a lot of these food sources are based on very late or data that was a long time ago, and so today we don't see these particular numbers at the same amount. If you take too much selenium in, these are some of the signs and symptoms that we see. Once again, one of the things we look at is abdominal pain, because you can actually, and this is, of course, stomach, that we know that the gastric mucosa gets very inflamed if we take too much. And that can happen when we start to push 400 micrograms or more long term. Now, usually, not always, but usually under 300 micrograms or less, we don't get into this situation. We can, but once again, this is where everybody's different. This is what's interesting. I'm pointing out here for a second, the brittle nails. Think about this. When people say, oh, yeah, I have brittle nails, right away, a lot of times people think about deficiencies. But here's a good case that if you're taking too much selenium, you can actually get brittle nails. So if a clinician really wasn't well-versed on this, they would say, oh, you have brittle nails, you probably have hypothyroidism, you probably need to take selenium. Well, this person may have read that on the internet, and they're already taking large amounts of selenium, and it's not the deficiency that you're concerned about or should be concerned about, it's actually the excess of this particular nutrient. Prealbumin is another marker that we should be looking at, along with retinol-binding protein, and both of these are highly associated with zinc. And so, once again, the retinol-binding protein is a protein that helps carry vitamin A, and this is why we see vitamin A deficiencies associated with zinc deficiencies and also associated with thyroid. Another nutrient that we have to be a little cautious with is carnitine. Carnitine, there's kind of mixed reviews out there, but some of the reviews is if you give carnitine in large dosages, it can help prevent a thyroid storm. On the other hand, that some people say that, of course, carnitine is very essential. We know it's essential for fat metabolism and should be given to thyroid individuals. One of the things you want to do if you do administer carnitine with thyroid individuals, that you do that separate from the thyroid medication. I usually tell people to take it at the latter part of the day if they're taking thyroid medication early in the morning. Anemia is a common finding, once again, with these individuals, and this can go back to look at your autistic kids. Autistic kids often have anemia because they have a B12 deficiency or a zinc deficiency, and both of them can cause anemia. Of course, a B12 deficiency can cause a macrocytic or megaloblastic type anemia, where the zinc deficiency will cause a microcytic type anemia. So, once again, zinc deficiency can look exactly like iron deficiency. I could show you several CBCs where these people have zinc deficiency that present as a microcytic hypochromic anemia, and if you looked at that, you might think iron right away, because iron deficiency and zinc deficiency can present exactly the same way on a CBC, and there is no way you can determine if it's zinc or iron deficiency by just looking at a CBC. A very important nutrient, once again, in thyroid support or thyroid hormone production is, of course, iron. Everybody that you suspect has thyroid dysfunction, you always want to look at their iron. And one of the things I want to emphasize to you is just don't think, well, a woman that's in menopause, we really don't have to look at her iron because she's in menopause, she doesn't have a menstrual cycle anymore. Don't just go by that. I've seen several women in menopause that have iron deficiency that also have thyroid issues. And once again, the two initial steps, as I highlighted here, of the thyroid hormone synthesis is dependent upon this. Now, think about your younger individual. How many children are iron deficient? Numerous kids are iron deficient, which means, one, they could have thyroid dysfunction, they could have anemia, and once again, could possibly relate it to autistic type presentation. Iodine, once again, we know that that's important for the thyroid, but you can see here that it's also very important that we look with iron and iodine. We just don't say, okay, let's take iodine and start supplementing that, because once again, if the person is iron deficient, it's going to be more difficult to actually get the results that you're looking at. Vitamin A. Vitamin A is always a concern with thyroid, whether it's hyper or hypo. As you can see here, that thyroid hormones do facilitate the conversion of keratins to vitamin A. So once again, this is why if you give too much thyroid medication and a person's consuming a lot of keratoid-like foods, that you're going to get a higher conversion into vitamin A, and you could actually go into vitamin A toxicity or adverse reaction type signs and symptoms. On the other hand, if a person is low in thyroid hormone, that they are not converting their keratins into, once again, vitamin A. Vitamin A and iodine, there's definitely a connection. We have seen that when we have a vitamin A deficiency, it can also exacerbate an iodine deficiency. So once again, a nutrient that's very important for the GI tract, very important for the thyroid, but a lot of people are fearful of this particular nutrient because it's fat soluble. The vitamin D and inflammation, we talked about this with autism. We also see this with thyroid conditions. We see this with autoimmunity with thyroid in the case of like Hashimoto's, and that's more or less noted here, that vitamin D levels that have been suboptimal have definitely been associated with Hashimoto's and should be connected. So this is why you can see the connection between the thyroid and autism. We see a zinc deficiency with thyroid dysfunction. We see a zinc deficiency with autism. We see a vitamin D deficiency with both of these conditions. We see anemia associated with both of these conditions. So it goes on and on and on, and that's why, once again, when a woman is having thyroid dysfunction pre-pregnancy or during pregnancy, we have to consider certain nutrients. Here's just an example of a thyroid dysfunction case. This person has hypothyroidism, and think about it. I know we're running out of time right now, but just think about the nutrients that I mentioned, the importance, and this correlates very well. Hypothyroid patients, like I said, can have a vitamin A deficiency because of the conversion of keratins to vitamin A. Here's a vitamin A deficiency. Person can have vitamin D deficiency causes. This patient actually has Hashimoto's. So you can see there's some nutrients here that are low that definitely are associated with the immune system. And is, once again, is it the chicken or the egg? Did Hashimoto's develop first in this individual and cause these deficiencies, or did these deficiencies occur first and then cause Hashimoto's? Well, we wouldn't know unless we knew what the person's nutritional status was prior to Hashimoto's. But once again, I think it's very interesting that you see some very strong connections here with this test and the scientific literature. And these are just some graphs more or less showing you these particular levels and which ones are deficient. And once again, as you know, these are have changed a little bit in the new format of the micronutrient test. And once again, showing you the top portion, of course, is the adequate zone. The yellow portion, of course, is the marginal or borderline zone. And then, of course, the teal color is the functional deficient zone. So taking that into consideration, I think we might have a few minutes for questions. But I think it's very important that you realize that how these two conditions are connected, and you will probably see in the future how other conditions are connected to one another via nutrient deficiencies, and how these nutrients modulate the immune system or how they repair the GI tract and set up all these pathologies. I appreciate your time and listening, and hopefully this has been some benefit to you. And for those of you that treat a lot of these individuals, whether they're autistic or thyroid dysfunctional, will benefit from this. Okay, one of the questions was, can I repeat the better form of zinc glycinate? Now, you want to make sure you're not talking about gluconate. Gluconate is a very poorly absorbed salt form of zinc. They usually use zinc gluconate for zinc lozenges. Glycinate. There's a book out there. It's published in 2012, and I highly recommend this to all of you. It's called Amino Acid Chelation in Human and Animal Studies. It's by CRC Press. Excellent book. And this author, Ashmid, that's his last name, goes through the physiology, the histology, and the chemistry of these different nutrients and what affects them. And it's a very intense book, but you will get a strong appreciation for how sensitive the body is and what really allows us to take up these particular nutrients in the right forms. Okay, so another question was, can I talk about a bit more about how PPIs may affect the microbiome? So think about this. As you know, our GI tract is the largest immune system in our body. And part of the immune portion of the GI tract is the hydrochloric acid. When we take in food, we all know that food is not sterile. It has bacteria in it, it might have viruses in it, or fungi, whatever. As we bring that into our stomach, the hydrochloric acid helps destroy those organisms to a lower level. So when that food travels down the GI tract, our microbiome in the middle or distal small intestine and large intestine can take hold of those bad bacteria or fungi or viruses and destroy them. But if we're taking a PPI and we're cutting out the hydrochloric acid, decreasing our hydrochloric acid, we are knocking out one of the mechanisms of the GI tract immune system. And so that's why if you listen real closely, if you ask people that are on PPIs, they go, oh yes, when I take a PPI, I get a lot more flatulence, or I seem to get sick more often, or I have a lot more upset stomach. And so then what happens with, say, individuals that have injury, say they injured their ankle or their knee or something. Now they take an NSAID to help with that injury. Then they're also told take a PPI so the NSAID doesn't upset your stomach so much. And now the NSAID is increasing their intestinal permeability. The PPI is decreasing their hydrochloric acid. So now these organisms in our food that are not favorable to the GI tract start to proliferate. Okay. So those are just a few things I think that you have to think about when you are dealing with these individuals that are on these medications. And believe me, I'm sure you're just like me in my practice. I've seen numerous kids that come in and they say, oh yeah, my son or daughter, they had reflux since birth, and they've been on PPI their entire first year of life. Well, think about what we've done to those individuals. Yes, we don't want that individual to have reflux and to have esophagitis and predispose them to something more serious in their esophagus. But at the same time, we don't want them to get sick. We don't want their GI tract to get destroyed or their microbiome to be changed by that medication either. And are we addressing that? Are we looking at certain nutritional deficiencies that are caused by the PPIs at a young age of, the first year of life, and saying, we're going to change your microbiome by this medication? How many pediatricians are considering that? And, that's what's very important, is realizing that you're going to cause some nutritional deficiencies with those PPIs, address those nutritional deficiencies. You're going to affect the microbiome with those PPIs, address the microbiome with various probiotics and prebiotics, and help decrease those type of situations. Once again, I thank you for your time, and hopefully this is going to help some of your patients.
Thank you, Dr. Grabowski, for another wonderful presentation. We are currently out of time for questions. If you were not able to download slides for tonight's presentation, please send me an email at webinar@spectracell.com, and I'll be happy to send you a copy tomorrow. Have a great evening.